Hi, everybody. Amy Conley here with United Way of Door County. We're continuing our interviews with our partner organizations that we're investing grant dollars in 2024. And today I have two guests with me. So we'll have you guys introduce yourselves. Jamie, why don't you go first?
Sure, thank you. I'm Jamie Craig. I'm the program manager for Family Services Sexual Assault Center. Sophie?
I'm Sophie Seelan. I'm the Door County coordinator for the Family Services Sexual Assault Center.
Wonderful. So yes, we are talking about the Sexual Assault Center today, which is a program of Family Services of Northeastern Wisconsin. So guys, what is the Sexual Assault Center? What do you do?
Sure. Family Services Sexual Assault Center has been in place. It was established in Brown County originally in 1974, and in Door County in 1995, we added services to the program and expanded into Door County. So next year, 2025, will be the 30th year, 30th anniversary of the Sexual Assault Center services in Door County.
That's
Sophie, you want to
great.
give general update? Yeah,
Sophie, you want to give some
Oh,
updates on what's going on here in Door County?
yep, sorry. Um, yep, so we provide direct services and then also do community outreach and are just working on continuing to build our collaborations with the schools doing prevention education, and then also our collaborations in just other community multidisciplinary partners in the community to serve the survivors that we have in our community.
Right. So when we think about the Sexual Assault Center, we probably should look at it like two different sides, right? So prevention first. So you want to talk a little bit like maybe what you do with that community outreach, what that looks like, feels like.
Yeah, yep. So our prevention education community outreach, so that's one of the roles that I provide in the community. So what that kind of looks like is just building awareness and raising awareness in the community, if we're talking about the community outreach piece. So working with partners in the community, different organizations to help raise awareness on kind of what sexual assault is, what sexual violence is, because it is an umbrella term, and there's a lot of different things that not just sexual assault that are all part of sexual violence to help raise an awareness on what that is and how services that are available for support for survivors, and then also helping others to know what they can do to support survivors that are in their life, and supporting them, helping them getting connected with services, but also just being there to be a support person for them, because having that support system is huge and very important through the healing process for a survivor. Um, Another piece of that outreach portion is the prevention education that we mentioned. So the role of prevention education is kind of the collaboration that we're doing with the schools, doing the classroom setting prevention education, which is we have curriculums that we follow that are evidence-based and developmentally appropriate curriculums for kindergarten all the way through high school, and then also adult presentations. And those curriculums go over, each of them are developmentally appropriate, as I mentioned, and go over different body safety topics, helping the students and the youth to understand body safety, boundaries, what is safe, what's not safe, and knowing the difference between good and bad secrets, and also being able to use safety rules and know who the safe and trusted adults in their life are, who are people who aren't breaking their safety rules, and who can be there to support them and help them if they have anything unsafe or anything like that happening to them. So helping them to be able to identify who those people might be. And as I mentioned, those are presentations that we can collaborate with the schools to offer in a classroom setting, but it's also something that I offer one-on-one, that whether it's I get a referral from a community partner that a family could benefit from some prevention one-on-one presentations, or a family that I might already be working with, helping to continue those conversations of body safety, boundaries, consent, internet safety, all those different types of things in those one-on-one settings. And something that I really encourage when I'm working with a family, but then also whenever I get a chance in the community to be able to talk about prevention education, is that the being able to sit down and have a conversation and help to educate on these important topics is really great. but having those conversations continued at home by the parents and the safe adults in kids' lives is really important, because the one presentation a year, if we're able to get that, that is awesome. That's better than nothing. But those ongoing continuous conversations is what really helps kids to better understand how important these topics are. And something that I really like when I'm talking with adults about this is talking about it like any other type of safety issue that we talk about, talking about body safety, just like we talk about wearing a seatbelt in the car, helmet to go on a bike or scooter, is talking about body safety and what boundaries mean.
I love that comparison, Sophie, because I think there's a lot of people who are like, I'm uncomfortable talking about sex, right? And I'm uncomfortable talking about sexual violence or sexual assault. But yeah, if we look at it the same way as any other safety, you know, when we talk about mental health, we have that same conversation, right? You get a diagnosis of a cold, stomach flu, some kind of cancer even. You very much talk about it. If you get a mental health diagnosis, you're much less likely to talk about it. And families tend to not want to have those conversations. So I think that same reducing the stigma message is really important as we talk about the education and prevention, community outreach side of this. Thank you for bringing that up. I never thought about that. So that's great. So
Another
then,
thing,
oh, go
sorry.
ahead, Jamie.
Another thing with that would be if parents are feeling uncomfortable about having those conversations, but they're eager to learn and want to know, tips and tricks on how to communicate better with their children, or a certain issue might be happening in the home, or their child is struggling with something specific related to body safety. That's something they could contact the hotline and receive services that way to be able to formulate some of those conversations that work best for their child and their family as a whole.
That's great. So yeah, let's pause there then. So the hotline can be called for a variety of things related to this topic, right? Okay, so what is that number?
Yep. So our hotline number is available 24/7, and that is 920-746-8996.
Wonderful. All right, so now let's switch to the survivor side of things. So someone has been sexually assaulted. What types of services are you able to provide?
Yep, so we provide direct victim services. So our, like we just mentioned, we have our 24/7 hotline that's available. So anyone can call that hotline at any time, whether they're a survivor or even a support person of a survivor, to kind of just share a resource and learn more about how to support the person that they're supporting and their loved one. Our services, we provide services to primary and secondary victims. So how kind of explain that is, the primary victim is the person who is the survivor, the person who experiences sexual violence, and then the secondary victim is, for example, if the victim is a child, then we also have their parent listed as a victim, because they are also a victim in that situation of going through this trauma. And so we provide support to not just that child, but also their parent or their caregiver. And we do crisis intervention. So that's often how we are getting directly connected to survivors, is if they go to the hospital, we provide the medical advocacy at the hospital for say an exam if someone is getting that. And then we also do interview accompaniment. So if someone is making a police report, going and being there with them to share services and provide that emotional support in that moment while they're making that report. So that's something that law enforcement can call our hotline, and then we would be able to respond out 24/7 to provide that support for a survivor, no matter when that's happening. So that emotional support piece is something that we're providing with that crisis intervention, with that direct responding out. But we also know that survivors don't always go to the hospital or report right away. So sometimes there's been some time that has passed, and someone's trying to figure out what their options are. So sometimes we have people who call our hotline and just want to learn more about kind of this happened to them. It may have happened yesterday. It may have happened 15 years ago, and they're just trying to figure out what is available and what they're able to do. And they can call and we can help them with, if they are wanting to report, we can help them getting connected with law enforcement. If they are looking for more emotional support and services, that's something we also are able to provide and continue to provide that follow-up and that ongoing support. If someone does choose to go through with reporting, and if the case does get charged and go through the criminal justice process, we also provide legal advocacy. So providing accompaniment and support throughout the legal system, no matter how long that process may take.
That is wonderful. That is a whole lot of stuff. Jamie, anything you want to add to that?
All of our services are free and confidential, so we have no time limits on our services. As Sophie mentioned, we're with our clients for as long as they need us. And all of our services are client driven. So we're advocating based off what the client is wanting. So we're there to support them, giving them a source of support where a lot of times they might not have that source of support or support at home, or they might not be ready to share with others, which is completely fine. That's what we're here for.
Okay. So Sexual Assault Center of Door County. So Sophie, you have an office here in Door County. So if people schedule an appointment with you, then they don't have to drive to Green Bay. They can see you here in Sturgeon Bay, right?
Yep, that's correct. I do have an office here, but since I am the only advocate here in Door County, I'm not always at my office, so that's why it's still best to call our hotline to get connected with me. And like you said, Amy, we can schedule an appointment, and we do have a space here, so that's local. And then if it is a transportation barrier, because my office is in Sturgeon Bay, that's something we could find another meeting space as well, if that would be more appropriate or helpful to just alleviate that barrier if someone is coming from another part of the county.
That was my next question. Perfect. So again, what is that phone number people should call?
Yep, so that's 920-746-8996.
Wonderful. Well, I know you've got a whole team supporting you, Jamie and others supporting you in Green Bay, but you are one busy person doing a lot of really good work here in Door County. So thank you both for the service and the work that you do for our community. Is there anything else you'd like to say to our viewers today?
We just appreciate the support of the community and United Way over the years, since this is going to be our 30th year in the county. We appreciate the ability of sustaining the services that we're providing throughout the county, whether it's direct client services or preventative measures that we're reaching out in the community, and we receive that support right back. So thank you.
Well, thank
Yeah,
you.
and I think Jamie mentioned our services are free and confidential when we're working with survivors, but also I just wanted to mention, since we did go over prevention and community outreach, that those presentations are also free. So whether that's the schools, individual prevention, or an organization who's wanting a presentation from us, that all of those services are free as well.
That is great. I think that's really important to remove whatever those barriers might be. So thank you so much for that. Well, with that, we're going to end another one of our sessions. So thanks everybody for tuning in. I appreciate you learning more about our partners in this week, the Sexual Assault Center. Thanks everybody. Bye.
Thank you.
Thank you.